Welcome back to Epworth Live. My name's Dion and I'm here today with Ron Sultano, who's the Director of Emergency Medicine here at Epworth Richmond. So today we're just going to run through some questions that we've had, just some frequently asked questions around our emergency department. So maybe, if Ron, maybe you could introduce yourself and what you do here at Epworth.
Hi, I'm Dr. Ron Sultana. I'm an emergency physician. I'm also Director of Epworth Richmond Emergency Department and have been so for the last 12 years. So my principal role each day is looking after the administrative needs of the department and also working as an emergency physician.
Cool. So I guess we'll just get stuck into it. So the first question we had was, when should someone go to the emergency department instead of maybe doing other things like seeing their GP?
Yeah, that's a good question. On some occasions you won't have much choice in the matter, I guess. If you're sick enough and an ambulance is required, the paramedics who are well trained these days can ascertain whether you need to go to hospital or not, so they will obviously transfer you to hospital if you're that unwell. Otherwise, when there's some choice in the matter, as a rough rule of thumb, it's really any sudden change in your health is kind of a simple way to put it. So anything that's not very typical for you, including, for example, severe pain, and the pain may be chest pain, abdominal pain, headache. These are all common things we see in emergency every day. Might be other issues like injury, so lacerations, wounds, fractures involving bones, of course, or dislocations. Also pain, significant pain arising from any injuries that you need that injury assessed. Situations where you might have fever that's unexplained. Situations where you're not sure, or you can't even get into your general practitioner and the symptoms are escalating. A lot of people have illnesses that they're quite aware of what's normal for them, and when things start to head in when things start to worsen or the patient's unsure what's going on, then it's time that sometimes it needs to be checked out in the emergency department as well.
Okay, that makes sense. And I guess when someone does have to come into emergency, it might be a bit of a rush, but what are some things that they should bring if they can?
Look, if it's handy, the most important thing for us really is your medications, or a list of your medications that are current, and any past medical history that's relevant. Anything beyond that really can get sorted out later, so I wouldn't get distracted by having to get clothing, toiletries, etc. ready to come with you. I just stick to the basics, and all that can be sorted out later, but we certainly love to know what medications you're taking.
Yeah. And when people do get here, I guess they could come in a variety of ways, through an ambulance or maybe bring themselves here. What happens when someone actually does arrive here through those ways?
Okay, usually the first thing that happens is that you'll be assessed by a trained nurse who's going to ask you a few questions about your illness, duration, for example, what symptoms you've had, how long it's been going for, what's changed. And all the nurses in Australia are trained according to the Australasian triage scale. So in essence, according to what symptoms you have, the nurses are well trained to say, well, look, this patient will need to be seen urgently, whilst this patient can wait to be seen. And that's really the sort of driving principle of emergency departments, that the patients who've got the most severe potential illness are seen first, and those with less severe or potential severity of symptoms can wait.
Okay. And I know Epworth have emergency departments here at Richmond, where we are today, and also in Geelong.
Yes.
And we actually publish our average wait time for Epworth Richmond on the website. Can you talk about what maybe the average wait time here is here at Richmond?
Well, the average wait time to see a doctor at Epworth Richmond Emergency Department is, as you say, on our website. It gives us a snapshot of what the waiting time has been like in the previous hour, and overall our waiting time was around 25 to 30 minutes to see a doctor.
And are there any other factors, I know we talked about the triage system, are there any other factors that might affect how long it takes for someone to be seen by a doctor, or is that pretty much it?
Yeah, look, it could be a lot of things actually, and sometimes it's interesting for people who know how emergency departments work. You know, they're a department that's have a lot of people involved in providing care. So it's not only, of course, the medical staff, there's nursing staff, there's orderlies, there's clerical staff, radio, and then behind us there's obviously the services that help us make diagnoses, for example, radiology, pathology. And as you can imagine, it's quite a complex system actually, and depending on the complexity of the patients and when they arrive, how many arrive in a particular time, what resources we have available, whether we ourselves have staff who might be away with another patient in another department, or in fact we may have, just as any department has, we may have staff who are unwell, sick themselves and haven't come to work, then all of those factors can play sometimes a role in how long it takes to see a patient.
Okay. And when someone is actually in the emergency department, what can they eat or drink or do while they're here?
Yeah, look, we usually advise not to eat and drink anything really until either the nurse or doctor says that can happen. And we say that because we're not initially sure sometimes of what the medical problem is, and in some situations it might be found that the patient will need surgery, for example, and the surgeon and anaesthetist would prefer that the patient is fasted for that procedure to be done safely. Okay. So in the first instance, we just say don't eat and drink anything. Let us just find out what's going on, and then we can make decisions once we've full information.
Okay. And I guess assuming that someone can leave the emergency department and they haven't been admitted, what does post-treatment look like?
Yeah, the post-treatment can go down a number of paths depending on what we've found or what we provisionally think is going on. In the first instance, if we're reasonably certain about the diagnosis or the treatment that's being rendered, then it might be that in fact no follow-ups required. We expect that the illness or the problem will resolve on its own. The next layer up would be, where we believe that the condition would benefit from follow-up, so we would provide the GP with a discharge letter and a note to the effect of the aspects of the illness we would like reviewed and see how the patient is trending. And again, in terms of other opportunities, specialist follow-up as well, where we believe a specialist consultation would be helpful.
Okay. And I guess the flip side of that is that some people would get admitted and then they go to different wards. Is that what happens?
Yeah, so when a patient needs admission, that generally means that the emergency physician has ascertained that it's an illness that requires inpatient management, assessment, treatment, whether it's surgery or medical treatment with medications in a hospital environment to produce best outcome. Really, where the patient ends up depends on the problem. So, is it a heart issue, so you end up under a cardiologist? Is it, surgical issue like appendicitis, which will end up under a general surgeon? And within the hospital, of course, there are going to be different areas which cater best to those conditions with specifically trained nursing and medical staff there.
Okay, cool. And I guess especially coming up to the holiday season, people are travelling and we do have international visitors here. How do we cater for international visitors, and how is that different?
Yeah, look, we do cater for international visitors. In fact, being so close to the central business district, the Port of Melbourne, and really a relatively easy drive in from the airport, we do actually see quite a few international visitors. We also lucky enough to be close to major sporting precincts, major sporting events through the course of the year. So again, we see a lot of international visitors as patients. In essence, it would work much similar if you were overseas and you had to access medical care in another country. So, being a private emergency department, there are out-of-pocket costs, and the international visitors are made aware of that. And then at some point, of course, they would access their insurance. That usually lags a little bit behind, but claim sort of the costs against their insurance depending on how the level of insurance that they have taken on board before travelling.
Okay. And what about how busy we get in the emergency department? Are there particular times that we're the busiest?
Yeah, if you mean times of the year, our busiest time of the year is actually this month. We
Wow.
find that December's a very busy month in terms of presentations, closely followed by sort of winter month, August. And last year, for example, we had a really busy August because of the flu. This year likely hasn't been as busy. So December's usually our busiest on a weekday. If you're looking at it from a weekday perspective, that question, then Monday's usually our busiest, and time of the day usually from about 11 a.m. to 10 p.m. It's kind of fairly steady.
That's probably all we have time for today, but thanks so much for taking us
No,
through
thank
and giving us a snapshot into what is the emergency department, especially here at Richmond. We'll pop a comment below with a link to how you can sign up for updates on future Epworth Live videos that we're doing, so you can sign up for that. Otherwise, thanks for joining us, and if you have any questions, feel free to pop them below and we'll get back to you later on. Thanks!